Great. Thank you so much, everybody, for introducing yourselves over the chat. We have a fantastic crew here today, and we're excited to get today's topic going. So can everyone see my screen now? You having better luck? All right, great. So the overall goal today is to have a community conversation about vaccination wellness for older adults and people with disabilities in Maine. And we're pleased to be hosted here at Northern Light Home Care and Hospice, which, as many of you know, has locations across the state. And your hosts today are Southern Maine Agency on Aging, as well as our partners across the state. So for those of you who are not familiar with the area agencies on aging, there are 5 of us. You can see us listed there: Aroostook Agency on Aging, Eastern Area Agency on Aging, Seniors Plus, Spectrum Generations, and Southern Maine Agency on Aging. And as the local one-stop shop for older adults and people with disabilities, we are really here to serve the communities with the greatest social and economic need. And that's why we're so excited about today's conversation. So our agenda today is I'm soon going to hand this over to our panelists to talk about a CDC update on the state of vaccinations in Maine. And we're so pleased to have our partners at the CDC here for the conversation today. Then we're going to be followed by some expert panelists who will share key lessons learned over the past few years when it comes to vaccination and really provide insight, information, and feedback around what we need to know. And then finally, for those of you who are interested in staying on, we're going to have some breakout networking groups. And we'll talk specifically about 4 different topic areas: community partnerships and events. We'll talk to our healthcare partners, outreach and education, and then any supportive services as well. And just by way of background, the Exchange is a group here in Southern Maine Agency on Aging that meets quarterly, sometimes more often. We relaunched this group last year as a way to connect with local providers here in Southern Maine. And over the past year, we had about 180 different service providers participate in our conversations. But today, like I said at the beginning, we're really opening this up to partners across the state to know and understand what's working and what's not when it comes to vaccinations for older adults. And the reason that we're having this conversation is that the area agencies on aging were recently awarded a grant through US Aging, which is our national affiliate. And through this grant, we hope to reach underserved populations, and of course, in particular, older adults and adults with disabilities, whether they are in more rural areas, whether they are part of marginalized populations, individuals of low income, and individuals with dementia. So again, we're really excited to learn directly from our partners here today. So without further ado, I will just hand this over to Nancy and Lindsay with the Maine CDC, and we're just so thrilled to have both of you here today. So thank you.
Hello. Good afternoon, ladies and gentlemen, and thank you to Megan and Carly of the Southern Maine Area Agency on Aging for the invitation for us to speak with you all today. My name is Nancy Beardsley, and I am the Acting Director of the Maine CDC. I'm here with my colleague to my left, Maine CDC Communications Director, Lindsay Hammis, who incidentally was our Director of Vaccine Communications for the last 2 years. Before we dive into the nitty-gritty details, I want to say congratulations to the 5 Maine area agencies on aging for having this $500,000 grant awarded. The grant will go to supporting vaccination, education, and outreach efforts in Maine to ensure older adults and adults with disabilities receive vaccinations. This has been, is, and will continue to be vital work. I also want to acknowledge that Maine would not be where we are today, faring, frankly, as well as we have through this pandemic, without the collaboration and partnership of everyone gathered here today. Maine's area agencies on aging, healthcare providers, pharmacies, home care providers, and community organizations have formed Maine's patchwork quilt of a COVID-19 response that has done a remarkable job of keeping Mainers, and particularly older Mainers, safe and healthy. This was not always a guarantee. At the start of the pandemic, Maine's fate was not predicted to be quite so rosy. Given our state's status as the oldest demographic in the nation, and given that we have a population rife with comorbidities, many models, predictions, and schools of thought indicated that Maine would be in for an extremely rough ride. Now, that is not meant to diminish the loss that too many Maine families have experienced over the last 3 years. And I personally experienced the loss of my mother. Each of those losses is one too many. But the fact of the matter is that we were slated to experience so much more loss. And the reason we did not, excuse me, just let me find my place. And the reason we did not, the reason that we are here today talking about how to continue to keep our elderly and vulnerable populations safe. Oh my goodness. Safe as we move into year 3 of this pandemic is because Mainers pulled together and took care of one another. 3 years on, we have the benefit of hindsight, experience, evolving science, and perhaps most importantly, a dedicated community of partners and providers whose resolve to care for our aging and disabled populations across the state has only grown. Today, Maine is in a pretty good place. 83.5% of our population has completed their primary series of COVID-19 vaccine, putting us 4th best in the nation. When you look at how many Mainers have had at least one dose of vaccine, that number goes up to over 95%. Looking at how we're doing in terms of boosters, we know that just over 30% of Maine's total population has gotten their updated bivalent booster. But zoom in on the most vulnerable population in need of protection, the group we are here to discuss today, and we see that 68.5% of Mainers age 65 and older have gotten the latest booster. And now I'm going to hand off our remarks to Lindsay Hammes.
Thank you, Nancy. There. Can you guys hear us okay?
Yes.
All right. So those numbers that Nancy just mentioned, they are really not bad, right? In fact, puts us pretty much at the top of the charts in comparison to other states. But that's not good enough because, as Nancy alluded to just a moment ago, Maine also has the oldest population in the country. And we know that COVID-19 disproportionately impacts older folks. Age is unquestionably the strongest predictor of severe disease, hospitalization, and death for those who contract COVID-19. According to the US CDC, as compared with those who are 18 to 29 years of age, the risk of death is 25 times higher in those who are aged 50 to 64 years old. It's 60 times higher in those who are aged 65 to 74 years old, 140 times higher in those 75 to 84-year-olds, and 340 times higher in those who are older than 85 and older. So that's why we're here today, right? To discuss what works and what doesn't in terms of getting Mainers vaccinated. Now, we know that for a large swath of the population, COVID-19 is not something that they want to hear about anymore. Talk of vaccines, public health measures, precautions, it's all old news. And if they had their druthers, it would stay that way. We also know that once we look at the numbers in Maine, say for the 50 to 64-year-old age group, booster rates drop off precipitously to about 32.5%. Reasons for lack of uptake amongst this still vulnerable population could be many. We understand that while 92.5% of that age group, that 50 to 64-year-old age group, has completed their primary series of vaccines, there still may be questions about the eligibility for new boosters, questions about side effects of the vaccine or the effectiveness of the vaccines given the cadence that they've been rolled out at. That said, studies show that when a healthcare provider or other trusted figure advised this age group about the importance of getting the booster, and when the booster was easily accessible, uptake improves. So for older Mainers, I see two very clear takeaways for us for today's discussion. The first one is messaging. Messaging to Mainers 50 and older about the importance of getting the updated COVID-19 booster is paramount. The first thing is we need to share that they are in the age group of people most likely to suffer the most severe impacts of COVID-19. And we need to let them know that if they've not done so yet, they need to get the updated booster because it's the most effective at combating the latest strains of COVID. This is important, even if others have moved on or decided they're done with vaccines. Essentially, we may be done with COVID, but it's not done with us. Much like we regularly seek out flu vaccines, pneumonia vaccines, shingles vaccines, we need to position the COVID-19 vaccines in the same way. Make it a normalize the vaccine alongside the others. And while COVID may not be done with us, we know how to protect ourselves. And it's with this one small vaccine. That vaccine is a great way to ensure that older Mainers can feel safe, enjoying life's moments, big and small. The second thing that I think we should talk about is access. The biggest barrier to this group getting vaccinated is now likely access. So first, they need to know that they're eligible, but more importantly, they need to be able to get to it. For populations who are homebound in nursing or assisted living facilities, group homes, or who just have a harder time getting out and about, making sure that the vaccines are available to them through clinics, home care visits, in social settings like at the area agencies on aging will likely mean greater uptake. The pandemic is no longer raging, and that's a good thing, but it also means that regular community clinics and mass vaccination sites have dwindled. Making access to vaccinations simple will translate into that greater uptake. And now for one more final point that I can't help but make. Today, our conversation is focused on how we can help older Mainers and those living with disabilities stay safe, healthy, and protected. But we have to remember that the reason Maine has fared as well as we have is because everyone rolled up their sleeves, literally and figuratively, to help our friends, neighbors, and communities. While COVID-19 may not hit as hard these days, especially for those under the age of 50 and those living free of comorbidities, it's incumbent upon all of us to do our small part to help keep our loved ones, our friends, our neighbors, our patients, our clients safe. That means those of us who work at the area agencies on aging, those of us who provide in-home care, those of us who are CNAs and PSSs have regular interactions with these populations also need to get boosted. Literally everyone 6 months and older is now eligible to receive an updated booster. And so by increasing uptake of the vaccines across the community of people who take care of and interact with our older and disabled Mainers, we are caring for them. That is an act of caring. Getting the booster is an act of love for others. It's a small thing we can do to ensure that we can all enjoy the big and small things in life. And with that, I will hand it back to you, Megan.
Wonderful. Thank you so much, Nancy and Lindsay, for these remarks, which have really just set the stage, I think, for the work ahead of us. And I have been furiously taking notes, as I know some of my colleagues have. So just as a reminder, we are recording this and we will send everybody some key takeaways from the discussion today. But now we can open it up to questions of Nancy and Lindsay while we have them here. And one question that did enter the chat, Lindsay, is one of my colleagues in Aroostook County was just wondering if you could repeat the statistics again, I think particularly around the 50 to 64 age group.
Sure. Sorry, we're playing musical microphones over here. So if the question was on the risk rates, yeah, I've got that at, so as compared to 18 to 29 64-year-olds, the risk of death for those in the 50 to 64-year-old age group is 25 times higher. 60 times higher for those aged 65 to 74, 140 times higher for those 75 to 84, and 340 times higher in those 85 and older. For the statistics of how many Mainers 50 to 64 have gotten their booster, if that was the question, that is, let me just double check. Did I have it in here? I think it's 32.5% of 50 to 64-year-olds versus 65 and older, we're at 68.5% of the population. So a really good job once we start to get to the 65 and older mark, still more work to do. But once we get below 65, that drops off really quickly to 32.5%. So a big bit of work to do there.
Thank you so much, Lindsay. So I wanted to invite anyone who is here in the Zoom room or who is at Northern Light, if you have any questions in particular for Nancy and Lindsay, who just did that really fantastic briefing, now is your chance. So if you have a question, you're welcome to just raise your hand or type it into the chat. So Joe Ellen has one question. What are your thoughts about community dining for senior centers?
I'll jump in. So I think where we are today is, everyone needs to it goes back to that everyone needs to look at their own level of risk and comfort with risk, right? We can't say that there is none because we know COVID is still circulating. That said, if the seniors who are dining there are up to date on their latest boosters, that's the best level of protection that we can have. Of course, adding masks and distancing and other precautions generally when you're out in the public are helpful things for people to consider depending on their own levels of risk. But I would say that if you're up to date on your booster and you feel confident that those that are around you are also up to date on your booster, I would probably feel pretty safe with that. But everybody's going to have a different sort of level of safety that they're okay with. And unfortunately, we're kind of at the point in pandemic where we're not mandating behavior in the same way that we were, a couple of years ago. So everyone sort of has to look at what they're comfortable with.
There's another question. Can you identify?
Thank you. And I just wanted to circle back, Lindsay, to the two key points you made around messaging, which is paramount now, right? Even though the environment has changed, the sense of urgency for the booster is still there, as well as your comments around access. And it looks like that has led to another question around, can you identify the greatest barriers to getting the booster?
Yeah, I think in terms of barriers, it's sort of like what I was mentioning in the opening remarks. I think, especially for our older population, they just don't have the same level of accessibility, of personal accessibility that many of the rest of us might have. And so I think where vaccines are no longer at, mass vaccination clinics, it becomes more of a conversation with a healthcare provider or making an appointment at a pharmacy. Pharmacies across the state still have them. So you should be able to call your pharmacist at the local Walgreens or CVS or Hannaford. And a lot of times they still have vaccines available. So they are accessible in communities to a certain extent. They're just not, it's not publicized as much anymore. Getting folks to those places can be tougher. And that's why I sort of raised the idea that having clinics or setting up pop-up clinics at area agencies on aging, partnering with a healthcare provider to do that, come in and offer an afternoon where all of that, or maybe a morning, where folks can come to a place that they already feel safe going to, already have a way of sometimes navigating themselves towards, that's a good idea. And then for those who are homebound and, receive care in a facility, I think we need to talk about having vaccinations available in those places, whether that's, the visiting nurses that go in to see patients, or, likewise, healthcare providers in nursing facilities or assisted living facilities, having clinics there for them, because movement is going to be tougher potentially.
Absolutely. Thanks so much, Lindsay. And just as a reminder, we have just a couple of minutes for additional questions for our representatives from the Maine CDC, and then we're going to move to our expert panelists who have been doing some of this on the ground outreach to populations. So Lindsay and Nancy, there are just two questions that have come in. One is from my colleague, Katie, who is wondering, is it helpful to renew our efforts to talk about the incidence and effects of COVID because there is such less publicity right now? I mean, I heard you say at the beginning that's a lot of people are moving on. So how do we kind of best message and position that moving forward? And then a second question from Madeline, who is just curious, if an older adult 65 and up had the second booster in September, is there now a 6 month to 1 year range of time to have the next booster? Just curious about confirming that time frame. Thanks, Lindsay.
Okay, so the first question, actually, I'll take the second one first because I think it's more straightforward. The timeline on the booster, if you've had your second booster, the updated bivalent booster, you should have had one shot of that by now. At this time, the FDA hasn't indicated that folks of any age should go get a second one. That said, we know that the UK and Canada are moving that way for certain populations. And as I understand it, the FDA is going to be having conversations about this and may have a decision in the next couple of weeks. It may not be an updated booster needed for all populations, all ages, but they may come out and say people X age and older, or those with immunocompromising conditions should go get that booster. So we're staying tuned for that. And of course, from the Maine CDC perspective, once that information comes out, we will also work to update the public as well, through PSAs, through sharing information with you guys, our partners, so that you can share that beyond, because you have more regular contact, I think, with the public than we do. So you're really important in helping us carry that message. But at the moment, we're waiting and sitting tight to hear what the FDA has to say. The second message was on messaging and what do we do about the fact that people are kind of turned off from listening to this stuff. Well, it's sort of a little bit of an uphill climb, I will say. We're still talking about it here at Maine CDC. We're still posting about it on social media. We invite you guys to kind of keep your eyes on those feeds, share that information that we share there with your communities as well. We are working on an updated sort of booster campaign, particularly focused on older Mainers, that we think is going to launch later this spring and into the summer. The idea of that campaign I sort of alluded to in our remarks. And it also seems to be the messaging that the US CDC at the federal level is going with, but basically do the one small thing of getting a booster so that you can enjoy the big things of life. And we're thinking about things like, big and small things, right? Like the community congregate dinners that seniors tend to have, but also weddings and graduations and, those sort of gatherings that we've missed so much for the last couple of years. So by getting the booster, people can then enjoy those events more safely and feeling better about it. That's the messaging that we're going to be working on. I invite you guys also to share that. I know that the US CDC has just put out, I think in their We Can Do This campaign, they've just put out a video that also magically alludes to that same kind of messaging. Feel free to have a look at that and share that too. And like I said, we'll do our best to also keep you all informed so that you can help us carry those messages. We do still have our website that's www.maine.gov/COVID-19. And then if you look at the vaccines, you can kind of see where the dashboard sits to show how Maine is doing on those fronts. We will also keep updated information there too.
Wonderful. Thank you so much for that really thorough update. I think, again, all of us were taking furious notes here and have learned a lot. So we just appreciate your being here and sharing your leadership and insight. And just as a reminder for those of you who joined a little bit afternoon, just wanted to remind you that we're here talking about vaccinations, what works and what doesn't. And this is hosted in partnership with the 5 area agencies on aging here in Maine. We're so pleased to just have that update from Nancy and Lindsay. And now we're going to turn it over to our partners who have been doing a lot of this vaccination access work on the ground. So we're going to hear from Trinity, Kathy, Nelita, Adam, and Lane. And we're really interested to know what insights you have and what you want to share around what has worked and what hasn't worked. So I'm going to go ahead and hand it over to Trinity just to do, you have 3 to 5 minutes to update us. And after we've heard from all of our panelists, we'll open it up for questions. So Trinity, thank you for being here on behalf of the Office of Aging and Disability Services.
Thank you for having me. And I just want to say thank you to Nancy and Lindsay. Great information. We always appreciate the collaboration that you bring to the efforts over at the Maine CDC. So thank you for having me. I'm really looking forward to the collaboration. I think that is really the key to being proactive with vaccinations and immunization. So my name is Trinity Baker, and I work with the Office of Aging and Disability Services. I am the Vaccine Outreach Manager, and I want to share some community events that have been most effective in engaging individuals in vaccination. So our partners, we've been working with specific partners who already serve individuals. I think that is really key. And we've been working with them to serve individuals with unique needs, to host pop-up clinics in spaces and environments that allow individuals to be comfortable and receptive to vaccinations. For example, pop-up clinics at group homes, at day centers, sensory-friendly clinics, and clinics providing communication techniques for individuals who are deaf and hard of hearing. Another effective way to engage the population is the ability for individuals to access vaccination services in their homes. This service is essential. And because we're talking about individuals who can't go to clinics, they can't go to doctor's offices or other community settings. So these individuals would not receive their vaccinations if it wasn't for the ability to receive them at home. When it comes to outreach and education, and I love that Lindsay highlighted this part because it really is essential. I think the important part is to use the providers who already have established relationships with these individuals. The initial trust is already built, and they're already often communicating on a regular basis with consumers. So a few examples of this really working effectively over the past couple of years is Maine's assessing service agency Maximus. They conduct a survey with every initial assessment, every reassessment, and every referral that comes in to collect data on vaccinations and provide resources on immunizations. Our service coordination agencies, they're collecting data, providing education, and making referrals to the other grant partners for vaccination while conducting their everyday work with the consumers. And like I said, they already have those established relationships and initial trust built. I think that's been really essential in getting those efforts off the ground. And then the Maine Long-Term Care Ombudsman Program, they're already in the facilities educating and doing outreach with residents. The grant we have with them has been allowing them to do this education and outreach with the staff members as well. One of the essential partnerships, and I'll mention it again, is the ability to access vaccinations in the home. Our grant partners have been amazing at this. This service is essential. These individuals would not receive vaccination if it wasn't for the ability to receive it at home. We've learned a lot about the vaccination efforts over the past 3 years, and I think some of the clarity we've gained is customizing communication techniques with individuals with unique needs, really understanding how they are receptive to the education and tailoring that education and the techniques we're using for the education to them so that they can clearly understand the benefits, the resources, and really being there as a support to connect them to those resources. Utilizing community partners that are already working with consumers, being consistent in providing reliable education. I know that one of the most frustrating things for a lot of consumers and individuals is hearing one thing and then hearing another thing that's the complete opposite. So I think really being consistent and having that reliable education continues to build that trust as a partner. And then the partnership, the collaboration is so essential. This grant has brought so many different providers together and fills gaps in the services being offered. Having an outreach manager that really is able to communicate effectively between the providers and connect to individuals with the appropriate provider for the services that they need is really important. So communication is key, and the success of the work that we all do every day depends greatly on partnering and filling the gaps together, because we can't do this alone. So thank you for having us.
Trinity, thank you so much. So many key takeaways there. Thank you for highlighting the importance of collaboration and communication. I know when we spoke prior to this, we were excited to just get so many of the lead partners in the room together on this issue, and also really appreciate the recognition that we need to meet people where they are, whether that's at home, where they live, or in their community. So really, really helpful. And next, I'm excited to hand it over to Kathy Bean, who is at Northern Light Home Care and Hospice, to share any lessons learned or words of wisdom with us. Thanks, Kathy.
Thanks. Thank you for, excuse me, thank you for having me. I agree with everything that Trinity just said. Early on, we learned that the if you build it, they will come format, where we had these mass vac sites that were sort of in urban centers, really worked well for many, but it didn't work for all. So we found that, developing these relationships, and fortunately many of them already existed, but the agencies on aging who would register people over the phone because people couldn't navigate the electronic registration, working with our CDC liaisons to find out where the gaps were and how we could go fill that. Working with immigrant groups, they're, all ages of immigrants as well, and having to navigate that while you don't speak the language as your first language was a real barrier. We partnered with schools, which we did some community events that did all generations. And so they went to bring their children, but the whole family could get vaccinated at that time. Pop-ups in rural communities, including our islands, really were successful. Many of those folks did not leave their island communities for 2 years. And so bringing the vaccine out there was really the key. I know she mentioned the meal sites, the senior centers. We've been to many of those and will continue to serve those populations because, again, as she said, and I really support, is bringing the vaccine to where the people are. I think we've done more than 500 homebound vaccinations, which is no small feat. So that we continue to get referrals for that. And I think, the messaging piece, clear and consistent messaging. As things have changed, people have had a hard time recognizing that this is an evolving process, that, the vaccine was new and the recommendations have changed as it goes out. So I think maybe some updated and very consistent messaging across all providers would be helpful in getting the message out to more. That's about it.
Thank you, Kathy. Great to hear some similar themes and also some new themes from what was shared earlier today. And thank you for your continued work on vaccinations. I'm thrilled to now introduce Naylita Burke with Portland Health, who can give us an update around what has worked from her team's perspective.
Thank you, Megan. Good afternoon, everyone. It's a pleasure to be with this group, especially with the two previous presenters, where I couldn't agree more that collaboration, and it's key, it's fundamental for this kind of work, because we cannot do this work alone. And also the important piece of bringing the clinics, the vaccines to where the community members are. So the Health Equity Program basically serves the different ethnic and racial groups, and we use community health outreach workers to implement our activities. So when COVID arrived, we have different initiatives, and one of them is the stakeholder alignment, where Megan is part of it. And so we have a rich human resources network, I will say. So the first thing that we thought about at the beginning as an immigrant, because I'm from Peru, I knew that addressing vaccine hesitant, it was crucial in order for us to reach out to this population. So so basically we did host, we partnered with different organizations, in particularly with the DHHS Commissioner Office, and we host educational sessions that were targeted to the CHAOs and community members from the particular communities that we serve, basically to hear from them what are their safety concerns, to answer their questions that they have. So then we were able to build understanding and enhance acceptance of the vaccine. So then what we did also, we were able to translate the education and materials that were culturally and linguistic appropriate to these target communities. And we elaborate flyers where people can go, because there was a lot of confusion at the beginning. So we hear the community concerns. Oh, I don't know what it is. So we partner with different organizations, and Kathy is one of them. Our CHAOs went to the places that we knew the clinics were having at the beginning, and then we move the model to bring the clinic to those community venues, such as Portland Housing Authorities, properties, churches, community-based organizations, and we partner. The good thing about COVID, I would say, for me, was the fact that we all came together, because we knew that our goal was to provide service to our community to make it healthier, and we all come together and we collaborate, and it was amazing how much collaboration was through this. And so CHAOs were able to, doesn't matter what organization needs, whether they have CHAOs or no CHAOs, our CHAOs were able to register patients, to answer questions or educations. They provide interpretive services for the clinics, and also they translate materials. So we were there, and I think it's important at this moment to still partner and look again where the community thinks at this moment, because especially with racial and ethnic groups, it changes all the time. And so where they meeting, where is more easy for them to have this vaccine, and education is still important, because people we think, oh, it's okay, we learn to live with COVID. So I'm happy that we are able to collaborate and to make our community safe. And I'm very pleased to hear those numbers that we're 40 in the country, right? So it's important. So let's keep up our excellent work. Thank you.
Thank you so much, Naylita. And thank you also for the recognition that things can change so quickly. And I think your examples of having some feedback sessions directly with the community to hear what are the concerns, what are the safety concerns, what's out there, makes me think that we should do some more of those. So that's really exciting. Thank you, Naylita. And next up, we have Adam Hartwig, who, for those of you who have not worked directly with Adam, he is the York District Public Health Liaison. Thanks, Adam.
Thank you, Megan. Can you hear me okay? Excellent. I want to know what short straw I drew, because it's tough enough following Lindsay and Nancy, but now Trinity, Natalia, or Nalita, and Kathy. Like those are tough acts to follow. But I appreciate the opportunity here, and kind of will build off of the things that everyone said. We learned a lot during COVID, and the one thing I want to stress is there is no blanket approach, because what works in York County is going to be different than Washington County and Aroostook, and really it goes beyond county. It goes town to town and community to community. However, we want to define that community of what is really going to be successful and appropriate for those individuals to feel comfortable and willing to roll up their sleeves and take the vaccine or have the opportunity to do that. I think the landscape during COVID was different, and obviously there was funding, so there was a lot of folks who were able to assist us to achieve the levels of success that we did. I say we as in everyone in the state of Maine. It's not we as in Maine CDC, because this wasn't a Maine CDC problem. It was an everyone problem. We were just one piece of the pie to solve it here. But we had so many excellent partners across the state who were willing to shift from their primary focus in their agency roles or even in their job roles or day-to-day roles to be a part of this response and have that in this effort to get folks to the numbers that we're at today. And having colleagues that I communicate frequently with in Vermont, Massachusetts, New York, and Florida, it really was unique to Maine. And in my 10.5 years here, I think that is the most telling thing about Maine is you don't know where the folks are going to come from, but when things go bad, they're there to assist. So to me, the realization that it can't fall in any one group or organization to do this, that is Lindsay and Nancy said so well, it has to be a collective collaboration. I'm glad you're doing this, because to quote Jim Budway, the former emergency management director in Cumberland, he said, we shouldn't exchange business cards in an emergency, right? You get together beforehand, you build those communications, that way you can call me. It's a trusted thing. It's building upon that stuff now, and then looking at the current infrastructure that's in place, whether it's pharmacy, healthcare, public health nursing, visiting nursing services, and seeing what pieces that they're able to handle, because it's very easy to overwhelm any one agency, and then trying to, work together as a group to make the vaccine accessible in the locations that are appropriate. Sometimes it works, sometimes it doesn't. I mean, we had vaccine clinics requested by the community at community locations with the vaccine, and no one showed up, right? We've also had vaccine clinics that were there for 4 or 5 days, and we did over 3,000 people. So it really resonates on how you get the message out and the collaborative getting that message out, because although you and I have a good rapport, Megan, and I have with Kathy. Other people who don't know me might be unsure of me, and my word that we're going to be able to do this in Washington County or some other place may not work. So it's using those leaders in your community to help stress the importance of these events and to help promote them, to get the most uptake, or to even get the buy-in to get your foot in the door to start talking about how you can make these happen. Because when you're talking about something sensitive like people's care, healthcare, vaccinations, this is a sensitive topic, and they kind of want to deal with a trusted face. They've got this, unfortunately, in York County, and they still talk to me. But, they want to feel comfortable and let you into their world to allow this to happen. And I think finding those community champions throughout the state, throughout the agencies on aging, to go and start to structure those conversations and see what the partners in your areas can do. That's really the success that we can build off coming out of this, because I think looking at the structures necessarily of how we did it during the pandemic, they're going to have to be tweaked, because unfortunately, even though Nancy and Lindsay have, good connections to people in high places down south, the money just isn't coming as it was, and that's just for everyone. So we have to utilize and leverage those resources that are in the community. No, I know they're spread thin, but there's little bites of that apple that can be taken as a whole to try to conquer it.
Thank you so much, Adam. So much ground covered in just a few minutes, but I loved all of the examples about how much times have changed, how we really have to change our approach town to town, county to county, community to community. And also, again, recognition of how our current situation is really different and is constantly evolving. So we have one final panelist, Lane Samsarian. We are so excited to have Lane here. She is with Disability Rights Maine and has been at this work for a while. So thanks, Lane.
Yeah, thank you for having me. So my name is Lane Samsarian. I am the health communicator at Disability Rights Maine, working on vaccine access for people with disabilities across the state of Maine. A lot of what I will be saying will be echoing off of what everyone else has already said, but that just shows the importance of what we're saying. So throughout my work with DRM and on vaccine access, key lessons and takeaways we have learned is one, how vaccine hesitancy is actually lower in people with disabilities, and that when educating and outreaching regarding vaccines, easy access, which has pretty much been noted by everyone, and creativity of information sharing play critical roles. When I first came into this position, I kind of did a quick little literature review, and it was found that people with disabilities are less likely to have gotten their COVID-19 vaccine, even though the reported vaccine hesitancy is lower than those without a disability. So this just highlights the fact that people with disabilities often have difficulty obtaining vaccines than those without a disability. Barriers that DRM has noted through working with clients and also through the literature would be transportation, scheduling, inaccessible websites and health information, inability to leave home independently, or to name a few. So going on to easy access, which a lot of people have talked about, bringing the vaccines to the people and the locations that are easily accessible for those who want to get the vaccine is super important. It's important to provide barrier-free vaccine clinics for those who want to get vaccinated and target specific populations that have lower vaccine uptake than or a harder time accessing these vaccinations due to barriers. So for example, what DRM did was last year, we actually had 2 deaf and hard of hearing friendly vaccine clinics. So those were specifically advertised to those communities who are hard of hearing and deaf. And since it was advertised to those communities, individuals showed up knowing that this clinic would be specifically tailored to their population needs. Whereas when you go into a community clinic, sometimes you would have to ask for these accommodations. So it brought in more people than normal of these specific populations. So the key takeaway with that is providing barrier-free vaccination appointments in clinics, making this a baseline rather than having someone requesting it. Also, because someone who's baseline hesitant to even get a vaccine will not follow through if there are barriers in their way, because that's an easy excuse to be like, oh, there's this in the way, I'm just not going to get the vaccine because I don't want to, and there's barriers in the way of that. Lastly, I want to touch upon a little bit of COVID-19 information fatigue. This can relate to anyone. The population is tired of hearing about COVID-19, this COVID-19, that, which makes it harder and harder to reach individuals and get them up to date on vaccinations, specifically in vulnerable populations like older adults and people with disabilities. So the work I've been doing, I've found through my social media work on DRM social media that when sharing information, it's kind of important to share it in a creative way. So one quick example is, February 14th was Valentine's Day. I came up with an infographic about spreading love, not COVID-19. So it was kind of lighthearted. It was still fun, but still informative. It's not being like, oh, more COVID-19 information. It's kind of like a roundabout way to get the information out there for people that don't really want to hear the information. So being creative in ways to get your information and message out there, I think, is important as we enter into year 3 of COVID-19, when less and less people want to be hearing about it and wanting to return to normal. So yeah, thank you for letting me speak during this, and I look forward to hearing what everyone else has to say.
Awesome. Thank you so much, Lane, and we applaud your creativity and the fact that you keep trying new approaches. I mean, it sounds like it's really important that we just keep at this and test and strengthen as we go. It looks like in the chat that there's some folks already starting to connect and collaborate who have not met before, so that's exciting to see. And we had a question from a public health nurse that we were able to get answered as well. But just wanted to remind folks that we have about 10 minutes to ask questions of our panelists or of Lindsay and Nancy with the CDC. So if there are any pressing questions that you still have, please feel free to raise your hand or stick them in the chat. We would love to hear from you, or if there are any observations as well.
Megan, I just wanted to mention that I need to jump off in just a few minutes. So just so that you know that.
Thank you, Nancy. So if you have a pressing question for Nancy, now's your chance. Okay, well, I think if there are not any questions or comments from our participants, I wanted to just again thank our panelists and thank Nancy and Lindsay with Maine CDC for being here today for this fantastic event. For those of you who are interested in staying on and doing some networking, I will go ahead and introduce those networking groups. We'd love to have your input and feedback again, because the Maine area agencies on aging are really hoping to learn from all of you to make sure that we're aligning our efforts and being as collaborative and strategic as we can. So thank you again to our panelists and our speakers. And I will go ahead and just introduce the networking groups for those of you who would like to stay on. So as a reminder, this is a regularly scheduled exchange networking group that we do with service providers here in York and Cumberland counties. And so if you are interested and available to stay on for the networking groups, we're going to have one that is focused on community partnerships and events. The second group is our healthcare partners. So that will be our on-site group who's here at Northern Light Home Care and Hospice. We'll have an outreach and education group if you'd like to weigh in on information, education, outreach. And then we'll also talk about supportive services, because as we heard from almost everyone today, making sure we have access to vaccinations is really important.